may be in the Philippines for SARS-CoV-2, we just continue to enforce strictly and properly the minimum health standards. Carlos.
Thank you po, Isek. Next question po from Joe Vicky of Philippine Daily Inquirer. First question, over the last few days, we've been seeing an increase in the percentage of severe and critical cases. Of the total active cases yesterday, 1.1% are severe and 1.5% are critical. Do these figures mean that we are seeing sicker patients this time around? Are majority of these severe and critical cases among the elderly, or are we seeing a rise in other age groups as well?
So Jovic, kailangan very careful tayo no when we interpret data, especially on how it is computed. So pag tinignan natin yung ating mga percentage as to severe, critical, mild, asymptomatic, kailangan tignan natin kung paano siya nakuha. So itong severe and critical as well as the other classifications no, or types of symptoms of a patient, this is computed against the active case denominator niya. So talagang habang lumilipas ang araw, lumiliit yung active cases natin because some are recovering, some are dying. So lumiliit siya. Pag lumiliit ang denominator mo, lalaki yung porsyento mo. Dapat tinitignan din natin yung actual numbers. And also, we look at the actual numbers comparing it to the trends in the past. And we can see na hindi naman ganun ang paglaki ng severe and critical. We continuously have this number lang for the severe and critical at hindi naman siya yung lumalaki ng husto. So we are maintaining no that trend for the severe and critical na less than 1% in the past at ngayon sabi mo 1.5, but as I've said, the denominator is continuously getting smaller because of the recoveries and deaths, kaya siya lumalaki yung porsyento. But the numbers hindi siya nag-exceed no doon sa moving average natin for these cases. So doon sa specific na tinanong mo yung sa age group, naipaliwanag namin yan no nung isang linggo. Although we can see that the cases now, the number of cases, yung most of it are in this productive age group that we have, no? Yung mga nagtatrabaho, pero sila yung mostly mild and asymptomatic. Yung mga severe and critical natin, still a big portion of them are still the elderlies and those with comorbidities. Carlos.
Thank you po, ma'am. His next question po is, how many clusters of infection do we have right now in PH, NCR region 4A, 3, and 7? And there are anecdotal stories that some of the cases observed the minimum health standards yet still got infected. What could be a possible reason for such instances?
Alam mo, sagutin ko yung pangalawa muna, Jovic, no? So kailangan lang natin isa-isip at isa-puso. Although sometimes no, we always say I'm wearing my PPEs, no, I'm wearing my mask, I'm doing physical distancing, I'm wearing my face shield, for example. Pero kahit gaano tayo ka-careful, if we are not going to be aware and vigilant, there might be times no, in the day na kahit nakaganyan tayo, we might miss out on something. We touch something, we forgot to wash our hands, we touched the outside of our face shields and touched our face. After that, we touched the outside of the mask and touched our face. Hindi na natin minsan na papansin, hindi ba? So, kailangan lang talaga ang mga tao remains to be very aware and conscious, no? Kasi kahit na nakapipis tayo, di pa rin tayo mag-iingat sa ibang aspeto, maaari pa rin tayong mahawa sa sakit na ito. Pangalawa, clustering. Based on our August 16 report, ang total number of clusters namin is 1,245 clusters. This is cumulative, ha? Ito ay galing sa aming event-based surveillance and response. So sa Philippines, by area, pag tinignan natin, almost 85% of these clusters are coming from the community. No? So it's 1,054. And then next would be the hospitals or health facilities where we have 5.5% of cases, and these are 68 hospitals or health facilities. And then we have the sa jails and prison, about 2.4%, mga 30 na mga jails and prisons and may clusters, and then for the other settings. Regions with the highest number of clusters would be NCR, Region 4A, Region 7, and Region 3. Ang NCR, meron siyang 411 na clusters. which comprises about 33% of all these clusters in the Philippines. Ang pinakamadami pa rin would be coming from the communities, which is 333 clusters in NCR. As for Region 4A, it comprises 17% of all the clusters in the Philippines, 216 ang kanyang number, where 198 of these are coming from communities. For Region 7, it contributes to 14% of these clusters, and 176 ang total clusters nila, 162 dito galing sa communities. And for Region 3, it contributes to 5% of clusters here in the Philippines, 68 ang clusters nila, where 61 are coming from communities. Carlos.
Okay, thank you po, Yusek. We'll send the breakdown na lang din in the group later so that our reporters can take note. Next po, from Claire Yao of Bloomberg. What happened to earlier talks with local pharmaceutical companies to manufacture vaccines here? What are their constraints?
Yung manufacturing, no, malaking trabaho, malaking proseso. As I have mentioned before, meron tayo dati, no, yung sa RITM, but it was not, para bang hindi na siya nag-progress, no, so na-stop na siya doon. Pero ngayon, ang pinaka-turnkey natin, ang requirement para makapag-manufacture ang bawat bansa ng bakuna, kailangan meron kang national regulatory agency na recognized. At sa ngayon, tinatrabaho pa lang yan ng FDA. When we had our initial meeting with the group for FDA, DOH, and the other agencies, DFA, isa yan, no, sa napag-usapan na isa yan sa requirement para magkaroon tayo ng ganitong klase na process dito sa ating bansa. So, ini-explore natin yan, but FDA already has started because there are requirements, no, para ikaw ma-recognize na national regulatory agency. And these are international requirements coming from WHO, and FDA is starting to work on that. And nagsiset na tayo ng timelines kung kailan natin mapapagawa iyan. Ano? So the most that we can do, ang ini-explore natin ngayon, yung sinabi ko sa inyo last week, yung fill and finish, no? So merong mga local manufacturers or even international, no, that they are interested din na mag-set up nitong fill and finish dito sa Pilipinas. Kumbaga, una dito na lang ilalagay dun sa mga lalagyan, ano? And then yun ay ipapalabas sa market. Kung sakasakaling matuloy ang ating mga usapan na yan. So we will still give further information in the coming days as to the progress, no, of these different exploratory talks with different manufacturers. Carlos.
Okay, as a follow-up lang po to that, ma'am, related. She's also asking why we haven't developed the capability to make our own vaccine.
Again, Carl.
Yes, ma'am. Claire Yao is also asking why the Philippines hasn't developed capability to make its own vaccine like its Southeast Asian peers.
Nagagawa na natin yan dati. As I've said, our ITM has been able to set up this vaccine manufacturing plant in the past, no? Kaya lang natigil lang because of some gaps na nakita. So hindi muna naituloy. Pero dati nakakagawa tayo. Hindi ko lang matandaan kung anong bakuna, no? I think that was BCG. Pero we will verify and we will post in the Viber group. Katulad ng sabi ko, ngayon ang ating major na kailangan is for us to have a matured national regulatory agency. Kaya nga tinitingnan na natin kung ano yung mga kailangan ng FDA para ma-fulfill natin yung mga requirements so that we can have a recognized national regulatory agency internationally, and then we can start having this kind of process. Meron din tayo ngayon na grant coming from ADB kung saan tinutulungan ng RITM para makita, no, yung feasibility of having again, no, para mapag-aralan, no, dito sa mga vaccine manufacturing plants kung paano natin gagawin. So uumpisahan na rin natin yan, and sabay-sabay yan alongside with FDA's fulfillment of these different requirements to become a recognized national regulatory agency.
Thank you po, Yusek. From Paul Adrian Samarita of TV5 Network. This weekend, photos of Attorney Larry Gadon surfaced on social media wherein he was seen not properly wearing his face mask, but instead he was seen wearing it in the wrong way by embedding it in his face shield. Attorney Larry Godon says that he does not believe in face masks, and he also seems to downplay the virus, saying that it's just like colds or cough. Can DOH say something about this, po?
Yes, actually, we are going to issue a statement no, regarding this matter. Unang-una, this is not a joking matter. No? So alam ng mga tao, lahat, may mga namamatay, may mga nagkakasakit, nagsasuffer ang economy, and the only way to go for us to, to fight this situation or to overcome this situation is lahat tayo magtulong-tulungan. So yung mga ganitong statements is not helping us at all. This is very para bang nakakaawa no yung mga healthcare workers natin na may isang kung sakali na magkakaroon ng pagsunod ang mga tao dito sa mga sinasabi nitong si nagsabi nito na parang magkakaroon ng parang false sense of information pa, misinformation, baka sumunod yung mga tao, hindi nila gawin, magkakasakit sila, and sino ba yung huli nasasalo sa mga nagkakasakit? Yung mga healthcare workers natin ngayon na are really suffering already. They are getting sick. They are being quarantined. Hospitals are having a hard time already. So sana lahat tayo, iisa lang ang pinabanggit natin, especially for those people who are known by the media, by the general public, na alam nyo na may role kayong gagawin. Kapag nagsabi po kayo ng mga ganitong misinformation, nagkakaroon po yung ibang tao ng pagsunod at false sense na akala nila totoo, dito po tayo magkakaroon ng problema, mas problema because currently, hirap na po tayo mag-enforce nitong minimum health standards. So we seek the help of everybody in giving the accurate information to our general public. Alam niyo po, yung pagsusuot ng mask, lahat po ng eksperto yan ang sinasabi. May mga studies na po at ebidensya, scientific studies, na sinasabi, when you wear a mask, you protect yourself 85% from being infected. When you do physical distancing, it adds more. And when you wear face shield, based on the local study that has just been released, 99% ang prevention. So sana po, yun pong ating mga general public, alam ko naman everybody's believing in the dito po sa ginagawa natin na pagsusuot ng mask. So sana po makinig lang po tayo dun sa accurate na information, sa tamang informasyon. This is not a joking matter, So sana po lahat ng tao na iintindihan nila kung ano po ang implikasyon kapag nagsasalita po sila sa public because people might be following them and this is not the right way to go. Magkakasakit po ang mga tao. We will issue a statement on this.
Thank you po, Yusek. I just want to emphasize po to our media partners that the statistics that Yusek mentioned for face shields, yung 99% po is face shields with mask and physical distancing, hindi lang face shields alone. Okay. Thank you po. Next po from Christian Yusores of Bombo Radio. Na-consult po ba ang DOH sa joint memo circular ng DTI and DOLE on free swab testing for workers in hospitality, tourism, and manufacturing sectors? Under the JMC po kasi nakalagay na workers under hospitality and tourism sector should undergo test every 4 weeks. On what instances po ba papayagan ng individual na mag-repeat ng swab test?
Yes, actually, ang DTI at DOLE naman, they work closely with us. They ask us, actually, they are aligned, They align with the policies of DOH. So, kailangan lang intindihin maigi yung nakalagay dun sa joint memo circular ng DTI at DOLE. Hindi naman nila talaga sinabing mandato. Sinabi, they may, so yun yung nilagay doon. So yung mga shall na nakalagay doon, these are for those who are symptomatic already that has to be tested. Tapos yung mga nasa mga tourist bubbles na sinasabi, hindi naman nila sinabi rin nakasama yan dyan. So that might be covered by another issuance. So kailangan lang natin i-clarify na hindi po mandatory ang testing, pero maari po silang magpa-test ayon sa nakasaad sa guidelines. So kailangan lang intindihin maigi kung ano yung nakalagay sa DTI DOLE Joint Memo Circular na ang nakalagay po ay may. So ibig sabihin, maaari magpa-test pero hindi minamandato na talagang dapat i-test.
Thank you, ma'am. Next question po is, nagbigay na po ba ng update ang DOST sa DOH regarding their meeting with Gamaleya?
I think we have already mentioned this last week, no? Na nung nagkapag-meeting sila, nakapagbigay ng information ang Gamaleya na itong bakuna ay gagamitin lang as emergency use for healthcare workers in Russia. So yung kanilang phase 3 hindi pa nila nauumpisahan pa lang nila, and hindi pa rin na-approve yung kanilang phase 3 ng kanilang Russian National Regulatory Agency. So ang Russia is still committed, no, to partnering with Philippines by having a manufacturer, no, na dito local that can be able to assist us in this technology transfer. So kung ano man basta yung bakunang papasok, whether it be the Sputnik 5 or the other vaccines available internationally, pag pumasok po dito yan, dadaan po yan sa masusing proseso ng ating regulation. So we will go through the FDA process, we will have the ethics review board because it's a clinical trial, and this will be vetted by our vaccine experts panel. Carlos.
Thank you, ma'am. From Aiko Miguel of UNTV, may recommendation na po ba ang DOH whether to restrict or ease restrictions in areas under MECQ? Granular lockdown po ba ang susundin na lang?
Pinag-uusapan ngayon ng IATF, galing ako doon, hindi pa tapos ang discussions. May mga presentation na I am not in authority to tell you whatever the decision will be. It is not me who gives that information. Antayin na lang natin mamaya, magbibigay ang presidente ng kanyang announcement, no? Maybe later on pagkatapos ng meeting naman with the cabinet in the afternoon. Basta alalahanin lang natin, Aiko, na whether the MECQ continues or it will be eased, mag-iisang restrictions, yung granular lockdowns, pinapatupad na natin talaga yan. Strinenten lang natin. And then yung mga recalibrated strategies natin na mga pinasok natin, yung code strategy, yung one hospital command, lahat yan gagawin na natin simula nung inumpisahan na natin. Actually, we are being very strong on this. Nagpababa na tayo ng mga tao sa piling mga lugar dito sa ating bansa. And we hope to mirror this in other regions as well.
Thank you po, ma'am. Another question from Aiko is, tuloy na po ba today ang vegan clinical trial? Ilang hospitals ang kasali po dito with 100 patients?
August 17 today, ngayon ay inuumpisahan na, no? Mag-uumpisa. Yan po ang sinabi sa atin ng proponent, no, last week, and overseers of this vaccine trial, vegan trial, I'm sorry. Nandiyan na rin yung ating stocks. Meron po tayong 4 na ospital na uumpisahan natin ang trial na ito sa Philippine General Hospital, sa Santa Ana Hospital sa Maynila, sa Dr. Jose N. Rodriguez Memorial Hospital, sa ito yung Tala dati, and in Quirino Memorial Medical Center. So we will start with these 4 hospitals, but of course mag-expand pa yung list of hospitals na yan for us to be able to have these 100 patients na sinabi na allocated na drugs coming from the Japanese government. The project will run for 9 months, no? So mag-umpisa tayo ngayon, and then after 9 months, tsaka tayo magsasubmit ng ating mga resulta for us to get kung anumang findings na magkakaroon tayo. Carlos.
Thank you, ma'am. From Sheila Crisostomo naman po. DILG Secretary Anyo tested positive for COVID-19 again. What is the possible explanation for this? Are you looking at mutation of the virus?
Di natin yan masasabi, no, mutation and all, Sheila, no, katulad ng sabi natin kanina, we still need a lot of evidence for us to say na talagang mutated na yung virus at nandito, yan yung kumakalat sa ating bansa. Basta ang alam lang natin, di ba, yung D614 at G614, ang strains na meron tayo sa Pilipinas, pero hindi pa nga conclusive kasi yung study ng Philippine Genome Center was just in the Quezon City area. So kailangan pang palawakin para makita natin ng maayos yan. Yung nangyari kay Secretary Anyo, pinag-aaralan natin ngayon. Nagkaroon kami ng pag-uusap-usap with our technical experts as soon as he announced that he was positive again, we are getting the details from the laboratory na pinagtestan niya, and we are getting the specific CT values. No? Ito yung mga medyo highly technical sa laboratory which will show kung talagang contamination lang o talagang positive talaga. No? So we will be giving information in the coming days, no, pagkatapos ng pag-aaral ng Technical Advisory Group. But just so that I just like to remind everybody again, ang RT-PCR very sensitive, no? So kahit na weeks after or months after the illness, minsan may nagpapakita pa rin ng fragments of the virus. So isa yan sa tinitignan pa rin natin. Although we would like to assess him as a whole, kasama ang clinical symptoms, kasama yung pagkaka-positive niya before, tsaka kasama yung technical details ng laboratory. So pinag-aaralan ngayon ng ating experts and we will give information in the coming days. Carlos?
Thank you, ma'am. As a follow-up lang po dyan, Yusek, Carlin Bonkin is asking, when we say that there is a reinfection, and how long do antibodies last inside the body? Kasi unlike Senator Zubiri, Secretary Anyo is experiencing symptoms daw po. Paano malalaman na di lang remnants ang nandun sa katawan and hindi na infectious?
Yes, Caroline, katulad nga ng sinabi natin, pinag-aaralan pa ng ating experts. The very reason why we would like to get also yung kanyang past history of being positive. Kasi gusto namin ikumpara. Kasi nung nag-una siyang nag-positive, he was asymptomatic, no? At ngayon may symptoms siya. So kinukuha namin yung detalye galing sa laboratorio para maipagkumpara ng ating mga experts para mapag-aralan pa ng further kung ano talaga yung nangyari dito kay Secretary Anyo. As to the antibodies, merong mga pag-aaral, no, na lumalabas, meron din galing sa CDC, na nung una, ang CDC sinasabi niya antibody stays until mga 3 months. No? Pero nung nag-aral sila further, nakita nila that even before 3 months, nawawala na yung antibodies, kalahati dun sa pinag-aralan nila ay yung antibody ng 3 buwan. Kaya nga WHO this meant that there is no immunity passport. Dahil hindi nga natin masisiguro na yung antibodies mo would stay that long in your body to protect you from being infected again. So kailangan lang natin magkaroon ng mas conclusive, no, ng mga ebidensya para makita natin itong antibodies natin, how long it lasts in a certain individual. Kaya nga lagi ang ating pakiusap, no, at ang paalala sa ating mga kababayan, kahit na yung mga naging positive na, no, at naka-recover na, wala po tayong immunity passport. So kahit na po gumaling na tayo sa sakit na ito, tuloy-tuloy pa rin ang ating pag-iingat sa ating sarili, pati po sa ating pamilya and the community as well. Carlos.
Thank you, ma'am. Another follow-up lang po related to reinfection, ma'am, from Michael Flores. How many cases in the Philippines are reinfection similar to what Sec Anyo experienced?
Well, let us not call it reinfection first, no? Because una-una, yung reinfection, hindi pa yan tinatanggap ng scientific community na meron talagang reinfection na nangyayari. Kaya hindi pa natin siya ginagamit na term, no, dito sa atin. Though alam natin this virus is novel, this is new. So kaya nga lahat ng nangyayari sa bawat araw na meron tayo ngayon, pinag-aaralan mabuti bago tayo maglabas ng confirmed na deklarasyon, no, or announcement. So reinfection, wala pa tayong evidence, no, na malaki para diyan. Kailangan pang pag-aralan. So kinukuha pa lang natin ng mga datos, no, dito sa Michael, dito sa mga sinasabi nating nag-positive na dati, pero ngayon positive na naman, no? So titignan natin kung makukuha natin yung datos na yan at magbibigay kami ng information sa inyo.
Okay, thank you po, Yusek. I hope that clears it out for our media friends. So next question po from Sheila Crisostomo. What is the position of DOH on the plan of IATF to ban smoking? Can smoking really spread the COVID virus?
Oh, well, pag tinignan natin, Sheila, no, how COVID-19 is being spread, maraming factors, no, when it comes to smoking, kung paano siya mas-spread. Unang-una, yung mga smoking areas, no? Kaya nga nagkaroon na ng polisiya ngayon, ang IATF sinabi na rin, kailangan sa isang kumpanya, for example, if a smoking area, have booths, no? Yung parang single individuals lang ang pwede. Kasi usually, itong mga smoking areas na to, maraming mga tao ang nagko-congregate pag naninigarilyo. And that would violate, no, yung physical distancing. And when you smoke, you don't wear your mask. So isa pa yan, ano? So isa pa yan sa magiging problema, walang mask, tapos magkakalapit ang tao kasi maliit lang yung area na binibigay for smokers kapag sa areas na yan. So that's one. No? The second would be, kapag ikaw ay naninigarilyo, nilalagay mo yung sigarilyo sa bibig mo, so nahahawakan mo yung labi mo, kung sakaling contaminated ang kamay mo, you might be able to get that infection. So that's another thing. Pero wala pa tayong scientific evidence na sinasabi talaga na ang tobacco o yung sigarilyo can make the person makakuha ng COVID, no? So wala tayong direct relation, no, dun sa tobacco and 19. Meron siya na relasyon dun sa ibang factor. So secondary, it's not really directly linked, okay? Pero ang isa pa nating pinapaalala, lahat po ng naninigarilyo, we call them or we classify them as vulnerable also. Because once they get COVID-19, mas nahihirapan silang gumaling, no? And this is based on scientific evidence. In China, nung nag-uumpisa pa lang, meron silang lumabas na study no, na pinapakita that about 25% no, of those people na nagkakaroon ng mas progression ng sakit are smokers. So, yun din ang isa natin paalala because we know that smokers, meron silang weak lungs, no? Dahil hindi sila naninigarilyo sila, no? So, kapag dumating sa kanila ang sakit, alam naman natin na yung lungs talaga ang pinupuntirya ng sakit na ito, mas mahirap silang gumaling. Kaya nga sinasabi natin, we have this special advice to smokers. And as I've said, the other factors that I have mentioned a while ago, ito yung nakakapag-increase pa ng risk ng smokers para mahawa because of these different factors. Carlos.
Thank you po, Yusek. From Christine Sabilio, nakapaglabas na daw ng unang batch ng bakuna ang Russia. Ito ba ay para sa sinasabing limited use para sa health workers nila or for clinical trials? Anong ibig sabihin nito para sa Pilipinas na mabilis na makakapagsimula ang clinical trials sa atin?
Well, Christine, no, katulad ng sabi ko kanina, ang report galing sa Gamaleya, no, they have used the vaccines for their healthcare workers under emergency use. And yung kanilang clinical trial, hindi pa rin nagsa-start because it has still to be approved by their national regulatory agency. So kung sakali na nasa stage sila ng emergency use, ang lagi din naman natin sinasabi, kahit na naaprubahan yan ng Russian National Regulatory Agency, kapag pumasok yan dito sa Pilipinas, dadaan pa rin yan sa ating regulatory process dito sa Philippines. So we'll just wait for further information and we will be sharing it with all of you kapag nandyan na.
Last question po that was submitted in the form last night, ma'am. From Red Mendoza of the Manila Times. The last case report that DOH released in the past few days show that many COVID patients that were earlier tagged as recoveries, but who actually died, which have raised suspicions on whether or not those who have actually recovered from operan recovery were indeed recovered. What can the DOH tell the public about these issues, as it may increase their skepticism over Oplan recovery, especially that there will be more patients that will be tagged as recovered due to the time-based recovery system by next week?
Yes, Red, no? Kaya nga nag-set up kami ng system pinaliwanag namin yun kahapon dun sa presser kung paano namin siya ginagawa. So kami ay may listahan, binibigay natin sa mga CHDs, and the CHDs in turn verify with their LGUs for us to be able to validate, no? Itong listahan na to, tanggalin nila dyan lahat ng may severe na case, lahat na may critical na case, lahat ng mga namatay, at saka lahat ng active cases pa. Para ang babalik sa amin after 1 week of cleaning that data would really be those people who has had the disease for 14 days and more. So that's part of our validation. Kapag nakakakita tayo halimbawa na dati recovered, ngayon pala namatay, this is because we are trying to reconcile our data with the local government units. Sa tingin ko, magandang indikasyon to. Kasi ibig sabihin, nahahanap na ng local government units ngayon itong mga individuals, no, na talagang nakalista sa kanilang mga areas. So ito po ay further natin i-improve, kaya nga po tayo may close coordination na and strengthening of our reporting units in the local government and in our centers for health developments, no, or the regional offices of DOH, para po masigurado at mas accurate ang nailalabas nating datos. Ito pong mga in the past, no, when we tried to impute yung 4,000 and then we had another 37,000, ito po ay may mga pagkatapos nun, meron po tayo mga paglilinis na ginawa pa rin ulit at dito natin nakita, no, na yung mga local governments reporting to us that those that were identified before ay yung iba pala patay at yung iba naman pala ay patay at yung iba severe or critical, no. So nasa report namin yan noon, this is 100 plus individuals. Kaya nga dito sa next step namin nung nagpalabas kami kahapon ng 39,000, ito ay nilagyan na namin ng process talaga na i-institutionalize natin para masisigurado natin ngayon na talagang maliit na porsyento na lang kung sakali ang may miss out natin kung meron mang nakasama dyan na died na pala or severe and critical pa rin sa ngayon. Carlos.
Yusek, there's one last question po pala from the form yesterday. From Maru Pahati of DWIS 882. Based on the report today, I think she was referring yesterday, 1196 po ang severe or critical, pero 832 lang ang ICU occupancy. Nasaan po ang 364 na severe or critical? Nasa regular rooms po ba sila or nasa ER?
Lagi nating tatandaan, ang mga nag-occupy ng beds natin, hindi lang siya yung confirmed cases natin. May mga suspects and probable cases din tayo. And ang nire-report lang natin dun sa ating situational reports would be confirmed positive cases. So for example, nag-report ang ating utilization na meron tayong ganito kadami na nag-utilize ng ICU natin. Hindi lahat yan confirmed positive. Meron pa diyang suspects and probable na nakakapag-occupy din itong mga beds natin for COVID. So kailangan very careful tayo when we interpret our data. So ang ano rin natin na kailangan hindi rin natin iisipin na kapag ang pasyente severe or critical, nasa ICU na siya lagi. May mga pasyente tayo na severe na nasa ward sila o kaya nasa isolation room sila. So hindi yun 1:1 na sinabi mo pag severe ICU bed, katumbas na yan. Hindi po ganun, no? So dalawang factors ang kailangan natin iisipin when we interpret this data. First one, it is not just the confirmed cases who are occupying these beds for COVID, especially the ICU beds. Meron ho tayong suspects and probable. Pangalawa, yun pong sinasabi natin na mga pasyente na severe and critical, not always occupies ICU beds. Minsan nasa isolation sila o minsan nasa ward din sila. So kailangan po natin maintindihan lang yon. Kaya hindi nagtutugma talaga ang datos. Carlos.
Thank you po, ma'am. So those are all the questions that we can accommodate po for today. I know you're very busy, ma'am. So all the other questions that they sent here in the chat, we will just compile and send it in the Viber group later. So before we end this, ma'am, do you have final messages po to our media partners?
Yes, thank you. I cannot stay long because we're having the IITF. Babalik ako doon. I just like to again thank you and sana po makatulong pa rin kayo sa aming pagpapakalap ng tama at accurate na information. Lahat po ng hindi namin nasagot ngayong araw kasi maikli lang yung oras natin, ilalagay po yan sa Viber group natin, sasagutin po ng team natin so that you can get the information. Again, we remind everybody to please be careful at sana po makatulong kayo sa pagpapakalap sa mga tao na dapat sila ay kasama natin sa laban na ito and they should be able to have that behavior na kasama sila at they have to be responsible for themselves, for their families and the community. So thank you very much po and we will see you on Wednesday. Salamat, Carlos.
Thank you po, Yusek. Thank you, everyone.